Welcome to Knovva Academy. My name is Alex Krasser and I'm head of online learning. We're very excited to present the Pandemics and Public Health Initiative designed to help teens around the world be better informed about one of the most impactful events of the modern era. The COVID-19 pandemic is an unprecedented challenge to our modern systems of healthcare, our economies, and our systems of governance. What medical sciences are we leveraging to fight the pandemic? How are we doing? And what can we do to protect ourselves moving forward? To help us answer these questions, and some submitted by students, we're very fortunate to be joined today by Dr. Felipe Fregni, the director of the Laboratory of Neuromodulation at the Spaulding Rehabilitation Hospital, a physician, and an Associate Professor of Epidemiology at the Harvard T.H. School of Public Health. Dr. Fregni, thank you so much for taking the time to join us today.
My pleasure. Thank you for having me.
So in a few words, could you introduce yourself to our students and describe a little bit of your background?
Sure. My initial sort of a training is on medicine. I am a medical doctor. I did my initial training in São Paulo, Brazil, where I'm from. Did my residency in neurology there, did my PhD there, also University of São Paulo, moved to Boston. I've been here for about 20 years. Initially as a postdoctoral fellow at Beth Israel Deaconess Medical Center, one of the teaching affiliates of Harvard. Continued, did few master's programs here at Harvard, and then became faculty. I think that was initially in 2005, junior faculty member, and then now I'm an associate professor at the T.H. and a professor at HMS. And I run a large laboratory of clinical research looking for new techniques to enhance neuroplasticity. So together with my interest in the sciences of clinical research methodology, that's where I teach at Harvard T.H. School of Public Health.
Well, you've been a very busy man. Thanks for fitting us in. So going back to the beginning, was there sort of an aha moment where you realized that you wanted to become a doctor?
Yeah, that's a good question. So I think was medicine. There was a lot of it was a mix between intellectual curiosity. So in terms of there's so much we don't know, so much we wanted to study. Plus, it is something rewarding. So you're doing something to help others, and for me it was the perfect combination between putting yourself in new challenges, intellectual challenges, and at the same time, so what you're doing has a direct impact on people's lives. In the medical school, it developed my interest in clinical research and investigation. Now I'm a full-time scientist and teacher here at the medical school and the School of Public Health. And then I just again, for me, the impact you can bring in clinical research and teaching for me that is where I felt I could put my effort in terms of helping, in terms of bringing new things.
And so just to be clear, clinical research is where you work directly with patients?
Exactly. So we do it, but as in the research setting, meaning that, again, patients come to participate in the research. So I like to tell my students in the clinical research course is that, so you should be careful of not wearing your physician's hat when you are doing research, meaning if you do research, you have to follow the protocol. It's different than when you're a physician that, you're trying to do anything for that particular patient. When you're a scientist, you're trying to answer a question. So that's a different thing. And sometimes it's difficult too, because I've been trained as a physician, but in research, you have to follow the protocol. But of course, the patient always comes first. And if there's anything that you think that the trial may be hurting him or bringing any detrimental effects, of course, the patient then is continuing the trial, etc. but you had to wear your scientist hat by doing when you have patients in our trial. So yes, that's where we interact with the patients in the lab, but as research subjects, as we like to say, to follow the protocol that was approved as well, of course, by the ethics committee.
So I see that you're an expert in evidence-based medicine. I personally would like to think that all use of medicine is based in evidence, but could you describe what evidence-based medicine is exactly?
Yeah, that's an interesting question, and as you said, yes, we like to think that. So there is an interesting, so for your audience as well. So let me just go one step back. There's an interesting book that was a physician here in Boston, Harvard, Thomas Lewis. So he described his experience as being a physician before the antibiotics. So that was in the post-Second World War, and medicine was very different. So, and I think that's the context that we need to think as well, how medicine has evolved as well. So again, beginning and even mid past century, so medicine was very different. It was much more in terms of comforting the subject, trying to do few things. There are not many things that you could do for patients. So it was a different profession. And then as you know, the drugs, there was this big development with drugs. Now, then the second wave of development with medical devices, and then with different procedures. So medicine has changed significantly, and that's how the evidence-based medicine came, because now there is actually real evidence. There is evidence from clinical trials. It's interesting. So the scientific development, together with this development of drugs, development of medical devices, you also have at the same time development of better techniques and better methods for clinical research, for clinical trial, meaning for testing drugs, testing medical devices. So, and that's the thing, that's what happened with medicine. So the collection of the data improved. There was new development of drugs and development of medical devices, and with all of that, then medicine has changed it for, instead of being based on a physician's own experience, was based on real data. So again, now it is clear this trend, but 20, 30 years ago, so I graduated in 1999. It was, I think at that point, I think there was the big sort of a growth of this idea of evidence-based medicine is still. So because at that point, and the internet also helped a lot with the evidence-based medicine. When I was in medical school, so if you wanted to check for papers, if you wanted to check for articles for that particular disease, you have to go to the library, you have to get on those cards, on these big file cabinets to find the paper, the journal, then you need to put it, ask a request, give to librarian, wait for 30, 40 minutes for the journal, if they have the journal in their system, which only the most important journals usually they have it, and then you get the journal, and then you get the article. So to read one scientific article, you need to go to the library, period, and you need to wait, about an hour to get the journal, and then to read it, and then you realize, no, that's the wrong article. Then you need to get another one. So you see that the access to data was very different as well. So I think the evidence-based, that's why there's a big increase in the evidence-based medicine. And I saw during my medical training, because there was after the internet, then you could go to PubMed. PubMed is the, for your audience, is the database where you search for the scientific articles related to medicine. And you could go to this website, and you can search, and you can see 25 years later, then internet was more accessible. So then medicine has changed significantly, and then that's why we call evidence-based medicine, and it's now more established.
So it sounds like evidence-based medicine deals a lot with research and looking at what we've learned previously about a given situation. So here we are in 2020. We're all self-isolating to protect ourselves from a global pandemic. And so I wonder, how do you apply evidence-based medicine to an emerging disease like COVID-19?
Yeah, that's a good question. It's something I've been discussing with my students in my course at the School of Public Health. And the main question is, should we change the standards of evidence-based medicine when we have a pandemic? Meaning, there's a standard for the minimal evidence you have to have it before giving the treatment to a patient. And just being very general, so you need a certain number of clinical trials, studies testing for the drugs, and you need a certain evidence for that showing that the drug is better than, for instance, for placebo. Okay. And the question now, has been, should we lower those standards so with to a lower level of evidence to use those interventions? Again, I think that's a tricky question. I'm not, I don't think that is a solution that do not bring harm as well. And I think that's an important thing to consider. So anything you do something, there's always consequences. And I think the consequence to lower the level of evidence in order to provide treatments that may show a little bit of evidence is a little bit dangerous. And then that's one thing that I say, look, I think there's two ways of doing. One is lower the level of evidence, and the other one is trying to speed up collecting evidence. I'm 100% favorable to collect evidence in a faster way. That's great that that's been happening. However, lowering the level of evidence or even changing the steps of the scientific development, I think that has potential actually important side effects, or let's put it this way, important negative consequences. Yeah.
So I assume some of the data that has to be collected is about diagnosis rates, rates of death and whatnot. So can you talk a little bit about how we are currently collecting those numbers, what the challenges are, and how we might be able to do it more quickly?
So again, the studies collecting on the rates of infection, to know the basic epidemiological numbers, meaning that the prevalence of disease, the incidence prevalence is a snapshot picture. So how many patients were infected, or to get the incidence, meaning how many new cases per day, per month, per week, and so on. So that's a longitudinal assessment. That is important as well. So there's two things here that I think that's important to emphasize. So one is the method of collection, meaning the diagnostic test. So for instance, you can collect for COVID-19, you can collect the viral load, meaning the active virus on the active. When you have the infection, you have the viral replication, and you can collect that. That's the swab that they do it. Or you can collect the antibodies, which is your response, your immune system response. Each one gives a different answer. One is for the active infection, and the other one for people who were infected. So, and that's one thing that's important to know. And also, the other important thing, besides of what you're collecting, is what you call sensitivity and specificity of the tests. What does that mean? So sensitivity is whether you can detect all subjects who are infected. And specificity is that for those who you detected, how many have the disease. You see, so these two things are important. So you want to detect as many as possible. However, you also don't want to detecting anything. So let's say you do a test that detect any viral protein. Then you start getting people telling that thinking they have COVID-19, but they have actually flu, they have other cold virus and so on. So, but also if you do too specific, you may also lower the detection rate as well. So that's all those things that's important as well. So at the end of the day, when we see the number, we need to see what's the technique that's involved. And I think that's an important thing, that sometimes this message, this detail is lost when you read the news on the newspaper. And I understand it's difficult to put all this technical information in a news story, but that has a big impact as well, how you read. And then finally, I think, again, as you said, how you collect that information is doing what you call sampling. That's one of the most difficult things in research. All of these is challenges. So when you read the final numbers, you need to see the whole picture, how the data was collected, then to make conclusions. So that's one thing that is difficult as well for understanding the information, for critically analyzing the information.
So it sounds like a healthy skepticism is important to understand that our data may not necessarily be representing the full picture because of the limitations of how the data was collected. And I assume it's important to have these numbers accurate for safety, among other reasons. And so along those lines, with so much pressure to produce a vaccine quickly, what measures are in place to ensure the safety and quality of that vaccine?
So we do have a good knowledge in terms of testing vaccine. And so I think that's number one. The issue here is that, as I discussed in the beginning, is how much you speed up that process. It's fine to speed up the process, but not to jump steps. I think that's one concern that I would have it. So in terms of, again, when you test a vaccine and you start from scratch, that's a difficult thing for this virus, because, and that's one thing I was discussing with my class yesterday with my students. Say, look, it is a completely new agent that, yes, true that there is a little bit of knowledge on the SARS-1, but it is different. It is a different mutated virus. So true that we learned a little bit, and we didn't learn that much on that first outbreak. And we have very little information about the mechanism of action for this virus to induce morbidity, to induce mortality, what happens, how our immune system reacts. So without knowing all of that, it is difficult to develop a treatment. It is difficult to develop a vaccine. So there's so many conditions that there are no vaccines, even though there's a big pressure to develop a vaccine. And you can list it as so many infectious agents that we have no vaccine. So I think it is important here to think on these two aspects. One, we can't jump steps, because if you do that, there's a risk that at the end of the line, we have a vaccine that, one, is not efficacious, and two, may lead to adverse effects. I think that's the important risk to manage. And two, if we are doing, if you're testing vaccines without knowing too much about the mechanism of this virus, there's also a risk that we spend a lot of effort and funds developing something, again, that will not be effective. And then we get in the end of the line and say, look, now we need to go back to the beginning again. We should be careful of having this certainty that, yes, in 1 year and a half, we'll have a vaccine. I wouldn't be that certain. It does seem that some targets were identified and they see potential good targets for the vaccine. But a I'll just be careful with that. I think at the same time, we need to develop plans for not having a vaccine in 2-3 years, or in 2 years, or in 1 year and a half, then even the, so what are the plans? So maybe at that point, herd immunity would prevent transmission, maybe, or maybe we'll develop other methods of isolation, different types of to decrease transmission. So I think that all these options need to be considered here. So in order to give time to develop an effective and also safe vaccine.
So obviously a vaccine is very important to help us return to normal. But there's, it's not just people who are patients of COVID-19 who are being affected by this pandemic. And so I wonder that in addition to a vaccine, what other types of research is it important to conduct during and following a pandemic? For example, research into mental health, the concerns about isolation, impact on essential workers, that sort of thing.
So I think all of these are important, and that's exactly as my last point in terms of the vaccine. So yes, we should put a lot of effort on that. We should give time to develop vaccine, but at the same time, we should exactly look at the other aspects of the disease, meaning that, research on decreasing transmission, research on other aspects as well. So such as you said, if isolation will become a norm, or at least relative isolation, let's put it this way, in few months from now. So what is the other aspects that need to be dealt in terms of mental health? And it's interesting because when for instance, if I'm doing study with Parkinson's disease in my laboratory, we don't go just for the motor symptoms, meaning the movement that these patients with Parkinson, they have limitations. But we also go exactly as you say. So Parkinson's disease, they have depression. So we also try to find treatments for depression. They have problems to sleep. We also look for interventions for that. So and with COVID-19, the same thing as well for the research. So you should not only give emphasis for that, but for all the aspects. So at the end of the day, research is very much driven by funding. So I may have wonderful ideas, but if I have no funding, it is truly impossible to test it. So I think this notion that I have a wonderful idea and I'll develop myself on the weekends and evenings. I can develop the idea, but at the end of the day, we need to test it, and it costs money to test. So there's no way of truly developing and testing an idea without funds. So at the end of the day, again, government and foundations, donations, so on, is what's going to dictate the agenda, the research agenda. And that's one thing, again, and hopefully there is a sensitivity to that for doing research in other aspects.
So it sounds like funding more medical research might be one systemic change we could make moving forward to help us prepare for future pandemics. So actually, to ask a question about those sort of big picture system changes, I'm going to turn it over to one of our students.
Hello, I'm Yusuf from Cairo, Egypt. My first question is about global health infrastructure. During previous outbreaks, there have been promises of reform in health infrastructure for developing and developed countries alike. However, as the coronavirus demonstrates, there are still major flaws in health infrastructure in many countries around the world, even in developed countries like the United States. And vulnerabilities in the healthcare system of one country can affect the safety of the entire world. My question is, do you think in the wake of the virus there will be actual reform in global health infrastructure? And if so, how do you think we should approach it during the crisis and afterwards?
Very good, Youssef. So that's a good question, and I fully understand your point of view, and it's a very valid one. So I don't see a short-term solution. I think there's two things to consider. One is, on one hand, the sharing of information is much more democratic, is in a way, so it doesn't need a computer and internet or even a smartphone to access the information. And most scientific papers that are open. That's one thing that's important. Information, at least, it's available for most countries. I think one research that one type of research that, again, is still is not given that much importance is prevention. Again, basic prevention. I think that's as much as we learn the mechanism, as much as we can prevent in terms of even simple things as diet, sleep, and etc. So that can help as well, and that can have a global effect if it is adopted. But at the end of the day, each country will have its own agenda, a health agenda and infrastructure, and even international organizations, they have a limited way of influencing. So the way I see it is share information. I think that's the only way to have an impact. And of course, at the end of the day, using the data that's being generated by research. So I think that's the only way to try to influence at a local level. But I don't see a global effort. That's not my area in terms of this big broad policy, but I just don't see it having an impact in health and infrastructure.
So you've mentioned the importance of sharing and spreading information. And of course, this relies on the internet, on publications and whatnot. And so to ask a follow-up question about that, I'm going to turn it over to another one of our students.
Hello, this is Alex Vilches from Mexico. Right now in our country, there's a lot of people that is not taking the right measures to protect against the COVID-19, but it's not only because they don't want to take the right path. It's also because they don't get their access to information to know what they should do in order to prevent the infection. So my question would be, what would you suggest for those people to do to make all of these people change their mind and start learning about the protection that they need to have against this virus, since most of them don't have access to internet or any other social media where they can see this information? Thank you.
Yeah, that's a very good question. And it's not a simple. There's no simple solution here. So we started this discussion with myself discussing the benefits and how much advances the internet brought to medicine, to evidence-based medicine, but that also brought some dark aspects or some negative aspects, and such as exactly misinformation, not only lack of information. There's two different things. One is lack of information, and the other one is misinformation. Again, that's a difficult thing as well to say. I do agree that there has a big impact. This infection, it is something new. So when you have something new, when you have lack of information, it creates a gap that is easy to be fed by misleading information. I think organizations such as this one, and trying to as much as possible to provide that, to again teach as well. So the teach or share the sort of how to check for the information as well. So that helps. But even though I think it's it's just difficult, and maybe there's an adjustment as well. So we've been seeing this explosion of misinformation, fake news, etc., in the past few years, but maybe there'll be a correction. So let us hope that that's the case as well. So this big media providers and social media as well providers, so hopefully they'll start thinking as well in novel ways to address this problem. And that's one thing that also you need to think as well. Anytime there's a problem, you also need some time to create a solution. Same thing with COVID-19, as I said. So it does take a while, unfortunately. So there will be a little bit of negative consequences before there are public policies to address that. But the awareness you are having, that's the first step.
Great. So we're talking about sharing information with the mass public, but I've also heard that there has been certainly a need, and I know to some degree it's been happening, that medical professionals around the world are able to share information. Would you be able to talk a little bit about how doctors and healthcare teams are teaming up around the world to fight this by sharing information?
There have been some initiatives. Of course, let me discuss some. So one is WHO has created a nice website repository for collecting different scientific papers, organizing that information. I think last time, I'm trying to remember now the numbers, so 10,000, 15,000 new articles or articles on that. That's one initiative. The other initiative as well, it's been happening. There is one issue when you write a paper, and that's why I said as well, it takes some time in science, because you collect the data, you have to analyze the data, you write a paper. When you write the paper, you submit it to a journal. When it gets submitted to a journal, before getting published that people can access and read, it needs to be assessed by what we call peer reviewers, right? So people with knowledge in the area that will review and will send the comments to the author. The author will address the comments in the article and will send it back. And the peer reviewers would check whether that's okay. And if everything's okay, the article gets published. So as you can see, that takes 2-3 months sometimes. And this time is being cut, is being shortened. But it still takes some time for the paper to get accepted in the journal. So what's been happening is now there is a big repository for papers on what you call a preprint status, meaning without the peer review, meaning you submit it to a journal, but the information is so important, you want to release the information with a disclaimer. This has not been assessed by peer reviewer. So that's another way it's interesting. It is being more used and is helping as well with the spread of the information and the collaboration. So I think at the global level, those are some examples that I've been seeing. But at the same time, so since a few years ago, there has been movement in terms of sharing not only the papers, but the data as well. So for instance, when you collect the data, you have your Excel spreadsheet with individual data, not only the aggregate data you share in the paper. Aggregate data meaning the means and the variation in the data and the graphs. But individual data meaning each subject, what happened, of course, in a anonymized way. But there has been a movement on that. And now it seems that maybe COVID-19 will speed up this as well. So more researchers are sharing the individual data set. So you can access that and you can do your analysis. Maybe you find a different association, a different correlation. So that is happening as well. So I would say those are the few initiatives that's been going on to help.
So You mentioned earlier that the news media may not be able to, or isn't really able to dive into technicalities and specifics. And I know from previous events that the news media tends to sensationalize things and go for black and white, quick answers and whatnot. And that has unfortunately led to a lot of misinformation being out there. Both that and, of course, social media and people spreading whatever information they want. So I'm wondering if you want to take a moment to address any major misconceptions about COVID-19 that you're hearing going around that you'd like to correct.
Yeah, so I think the one that I discussed in length in my course was, but I see that this misconception has been fixed, at least partially, the chloroquine or hydroxychloroquine for treatment of COVID-19. So the story of chloroquine is that this drug has an antiviral effect in vitro. What does that mean? It means that you get the drug and you, in a separate experiment, not in the human body, you see that the virus, they don't replicate. So that's what we call in vitro, outside a human body, for instance. So the drug inhibits viral replication. So based on that information, that there is a number of steps to human biology. They say, look, maybe chloroquine would be effective for COVID-19. And then there is one report saying that, oh, there's a trial that shows positive effect, but without the details. So based on that, then there was this misconception, and I think that was wrong. Oh, chloroquine does work for, or may have it. I forgot the exact words that they put it, but it work or it has a great potential, so on. And of course, the social media picked up that and started spreading that information. So, and also again, just a parenthesis here is on one hand, also it's very important for the mainstream media to be careful with the news that's being generated, because sometimes, if you say, look, a drug has a potential, there may be spin, and some people may start publishing their social media that there's a cure for COVID-19. So, and that's again an important misconception. And be careful with potential cures, potential treatments without being fully tested. And I think chloroquine was an example. And now it has been shown that the drug may even have actually a detrimental effect for COVID-19. So, we should be careful because there's a lot of unknowns. Sometimes, there is this, the beginning, or even a few weeks ago, you say, look, the transmission, if you stay 6 feet apart, that is fine. Which that's not really. So now we are learning more and more. There is an interesting paper published in Nature that there may be airborne transmission, maybe some particles, they detect some particles of the virus in the air, traveling in the air, not just with the droplets, so traveling in the air. It's still not clear whether these fragments, that means it's just fragments, or it could be virus, could be a whole virus enveloped there that could lead to an infection. But I think it's important that we don't know. I think that's one misconception, is that, look, if I just stay 6 feet apart, I'm safe. Be careful. I think at least should do that, please. But don't think that because of that, you are 100% in a clear. We don't know. There's a lot of things unknown. And I think that's one thing that, as a scientist, you are trying to think try to think on the unknown, which is a difficult thing to do it. So, and that's one thing that I see. So I see, for instance, people walking on the street, and then again, as I think they feel safe as long as they are 6 feet apart. It may be, we may learn in a few months, yes, there's only, I think the story is not that simple. I think what's important is, we still don't know the whole picture. So don't have the false sense of protection. I think that's one, the misconception in both ways. One is assuming that we know everything, and the other one, getting sort of false information in terms of new treatments and so on.
So with so many unknowns out there, how do we know what to do, or how do we know how to move forward, or when will we know?
Sure. Yeah, that's a difficult thing. I think one thing that we need to do it is, and anything sort of same thing as in medicine. So when you don't know, you're just careful. I think there's different ways of, and there's a little bit of a risk analysis, risk taking approach here as well. So if you don't know, you can go one extreme of trying everything, but that's not what we are taught in medicine. So again, the Hippocratic oath, first do no harm. And I think that's the same thing here as well. So, I would say in my view is, with that many unknowns, again, there's no way but it going one step after the other, being careful, analyzing the information, trying to gather as much information as possible. And again, being careful.
Is there anything additional that you'd like to share that we haven't spoken about, or any parting thoughts or words of wisdom?
One thing that I've seen is that good ideas and human inventiveness, it's something that we all have it, and there's different ways of sparking that ability, and sometimes it is in moments of crisis that it sparks these big ideas as well. So I think at the end of the day, I'm confident as well, either one way or another, but human inventiveness will address all the problems we're having. And that's also one thing as well for the younger audience to be thinking as well. So again, what I wanted to do in the future, how I wanted to dedicate my time as well. And this movement of innovation, this movement of innovation, not only in medicine, but in other areas as well, that has a big impact.
Excellent. Well, thank you for ending us on that note of optimism. And thank you for sharing your perspective on how important it is to think critically and be skeptical of information that we see, and even information that comes from science, that science is not, the science so far has not had the time to prove itself trustworthy. So thank you for encouraging our skepticism. And thank you again for taking the time to be with us today. I hope you and your family and your loved ones can stay healthy in this challenging time.
Wonderful. Thanks so much, Alex.